Hi, my name is Maxine Richards, and my research critique was done in an article written by 3 nurses. The title says, Testing the Feasibility and Initial Effect of Iron and Vitamin C to Enhance Nursing Home Residents' Immune Status Following the Influenza Vaccine. Now, as a long-term care nurse who have been working in a nursing home for several years, I can attest to this fact that this population is very prone to the influenza viruses every year, and there are several key factors that could contribute to this. Nutritional status is a big one. The fact that these residents are polypharmacists, all the comorbidities, this could be some of the reason why the influenza vaccine is so ineffective among this population. So the researchers were trying to figure out what were some of the factors, and iron deficiency anemia was one of the things that they tried to figure out if that would play a part in why this influenza vaccine is so ineffective among this population. And I will go to my slide to go over some key factor in the research. My first slide is the research problem and purpose. The problem was morbidity and mortality rate of influenza infection among older adults who were 65 and up living in a nursing home. And the purpose was to find out the initial effect of iron and vitamin C supplement on the immune status following an influenza vaccine on adults 65 and older living in a nursing home. Also, they wanted to test the feasibility of conducting an intervention study in the nursing home. The literature review, there were several literature review done prior to this. Research shows that influenza vaccine was effective among many groups, and some of it was highly effective, and in some was fear, but in the elderly 65 and older it was only 30 to 40% effective. They also did study in some hospital patients 65 and older, which shows that even after influenza vaccine there was still the virus still show up in their laboratory. And the researcher also did prior research on iron deficiency anemia. Study was done on 50 independent living and 50 institutional living adults 65 and older, and it shows that 4% of the men and 8% of the women in independent living had iron deficiency, while 40% of the institutionalized group did. The conceptual model or framework was with an operational definition was used because the researcher needed to test the variables that were used in this research. And the objectives in question, the researcher did not put forth study question, neither was the hypothesis explicitly stated, but the problem statement and purpose statement clearly implies what the intention was, or the phenomena was. The variables, the independent variables was ferrous sulfate, chelated iron, and vitamin C. Dependent variable is the immune response, and the research variables that were used were hemoglobin, serum iron, serum ferritin, and serum transferrin. Experimental design was used for this research, and the inclusion criteria was that the subject has to be 65 years and older, have one or more malnutrition predictors, history of weight loss, they must leave 25% or more uneaten food on their plate at each meal, they has to have a psychiatric or mood disorder, they must have a diminished ability to participate in ADL from the AM to the PM, they has to reside in the nursing home at least 6 months. They must not have an end-stage terminal diagnosis. They must previously agree to have an influenza vaccine, and they does not have currently take iron supplement. The exclusion criteria was not listed in this research, but one can infer that the opposite of the inclusion was the exclusion criteria. The subject size, the sample size was 14 subjects, and the population targeted was 65 years and age 65 years and older, and the setting took place in a nursing home. The measurement method not clearly described in the study, but the literature indicate that the biophysical measure using the physiological instrument were used, because the researcher has to test the variables, and the variables testing the results were labs, so they have to use this method. Although not described, the t-tests are presumed to compare mean pre-test to post-test value for the two groups. Mean and standard deviation were also used to measure variables. The reliability and validity, the researcher used standardized laboratory testing done through a local laboratory company, so they could not, they did not describe reliability of these instruments. Observation were not described. There was no indication whether there was separate place to document the variables. The nurses has to administer the irons and the vitamins 3 times a day with meal. There are also no mention as to whether there was an observer in place to see if these variables were being given. No way of guarantee that the variables were actually given at each meal, so this could have been a flaw in this design. Physiological instruments also were not discussed, but the method for recording the data were clearly laid out using the mean and standard deviation. No specific training or data collector as staff nurse administer these variables. Consistency was that the variable has to be given 3 times a day with meal. 2 weeks post intervention, lab has to be drawn and tested, and 30 days post intervention also. No report of omission was provided. No report of ethical violation was indicated. The data analysis, data was analyzed using table to show mean and standard deviation along with t-test to determine the differences between the two groups. Probability was also used, and there was no power analysis. The interpretation of the finding in this research was that there was no significance as related to the study purpose and did not support effectiveness of the intervention. Only the serum transference showed a significant difference. Neither iron nor vitamin C had any influence on the influenza antibody A or B post-vaccination. The limitation in this research was that the sample size was too small. There was difficulty in recruiting and retaining the study subjects. There was limited time frame to give the vaccination, as the nursing home wanted it to be done between October and November. So the conclusion of this study is based only on statistical significance finding, although the generalization of the study finding are based on previous research and knowledge of the subject being studied. The implication for practice is consistent with the study, because the study conclusion, as the researcher point out, that if improving nutritional status, which may include protein, calorie, vitamins, and element deficiency, may increase the effectiveness of using influenza in the nursing home. So nutrition is a very key indicator in this population as to where immune response is concerned. So that is something that could be looked into in the future, and nurses can research on that for further use. That concludes my research. Thank you. Thank you for listening to my critique, and this is a chart of food for the elderly. Thank you very much.